Welcome to Not Milk Never Milk. Subscribe if you're lactose intolerant.
You begin by prioritizing safety and confirmation. Gather a sealed, sterile enema kit and review your health status with a clinician if you have any medical conditions. Once done, inspect the kit for damage and expiration and set out gloves, a towel, and a waste-safe area. Make sure to read the manufacturer's guidance. This explains why sterility and proper supplies matter to reduce infection risk and avoid complications. Do not improvise with household containers. You need to understand the rationale behind each step rather than improvise. Manufacturers provide specific technique guidance because pressure, flow, and fluid choice affect safety and effectiveness. Once you've reviewed those instructions, consult a clinician about acceptable fluids and timing for your situation, especially if you take medications or have chronic conditions. Make sure you plan for gentle, slow administration to reduce mucosal injury, and stop immediately if you feel severe pain or dizziness. You complete the process by following disposal and cleaning guidance to prevent infection. Dispose of single-use items in a sealed bag and sanitize any reusable components per the manufacturer. Once done, monitor yourself for adverse signs such as fever, severe pain, or unexplained bleeding. These require prompt medical attention. If you encounter device failure, persistent discomfort, or uncertainty at any point, stop and contact a healthcare provider or urgent care for directed, safe troubleshooting.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.